Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner. In today's video, we'll be going over 5 NCLEX delegation and prioritization questions. Courtesy of nursing.com, there are 4 clients in the waiting room that the nurse must see in order of priority. Which of the following clients should the nurse see first based on the chief complaint? Remember, with prioritization, it's always like what's going to kill them first, right? So abdominal cramping doesn't sound severe. Failure to thrive is a chronic condition that can happen in like the elderly or in infants that aren't fed. Testicular pain and swelling, or knee pain and swelling. Testicular pain and swelling is an emergency. It could be like a testicular torsion. So testicular pain with swelling could be a testicular torsion, and this is considered a medical emergency. With testicular torsion, if they aren't seen quickly, then they could potentially lose the testicle. So even though in this scenario, it's not necessarily going to kill them, they're losing a body part. The difficulty of this question was medium, and 51% answered this correctly. And the nice thing about nursing.com is you can always have videos that you can review if you're not sure why you missed a question. The next question: a nurse is working with an LPN for the first time. The nurse has many tasks and is considering delegating some of them to the LPN, but does not know if the LPN has the skills needed for the task. Which action from the nurse is most appropriate? Delegate the task and then follow the LPN to ensure the task was done correctly. Ask the charge nurse if the LPN has enough experience to take on delegated tasks. Provide clear and concise instructions to the LPN when delegating. Avoid delegating until seeing whether the LPN has appropriate nursing skills. The fact that this person is an LPN means that they completed school and they've been checked off, they've taken tests. The most appropriate action in this scenario would be to provide clear and concise instructions. Avoid delegating. As a nurse, you're going to need to delegate. You can't do it all. So there may be times when a nurse must delegate with someone that you haven't worked before. And to eliminate confusion, you should provide clear and concise directions when delegating. Key here is the fact that it said delegate the task and then follow the LPN to ensure the task was done correctly. And it's saying that if you have to follow the LPN, it defeats the point of delegating. You should always follow up with the LPN afterwards and make sure that the task was done and all that. But you don't follow the LPN as they're doing it. A nurse in the ICU is caring for a client that has been ventilated for 2 weeks due to ARDS. The client's FiO2 has been 60% for the last 48 hours. And FiO2 is defined as the concentration of oxygen that a person inhales. The air that we inhale on a day-to-day basis is made up of 21% oxygen, 78% nitrogen, 1% trace elements. So normal air, or the normal air that we breathe on a day-to-day basis, is an FiO2 of 21%. So 60% is a lot higher than normal room air. FiO2 stands for fraction of inspired oxygen. So I'm not an ICU nurse, but with the FiO2 being this elevated, we're most worried about oxygen toxicity. And clients with ARDS require high levels of oxygen. Levels above 50% FiO2 for prolonged periods of time can cause oxygen toxicity. This is why the SpO2 goal for these clients tends to be approximately 92 to 94%. If a client has an oxygen saturation of 100%, the FiO2 needs to be decreased. Now, this was a medium difficulty question and 48% answered this correctly. I think that this question could have been made better if they had provided an O2 percentage, but they did not. Out of all of them, that was the best choice. Risk for sepsis, ARDS itself is not an infectious process. And although any client on a ventilator for an extended period of time is at risk for ventilator-associated pneumonia, the fact that the client's FiO2 is so high makes oxygen toxicity more of an immediate concern. With nursing.com, with the membership, you can always review the videos. The nurse working in the emergency department receives a client with altered mental status and a fruity breath. The provider diagnoses the client with diabetic ketoacidosis. Which intervention will be included in the treatment of this client? Select all that apply. So in diabetic ketoacidosis, blood sugar is extremely high. So we need to get some insulin in them. So symptoms of diabetic ketoacidosis are going to include frequent urination. So they're going to be dehydrated. So we need to start an IV. We need to give them fluids. We need to know what our starting point is at. How high is their blood glucose? And then electrolyte abnormalities can occur with DKA. So we need to get an EKG. So this is one of those where they're all correct. And if you see that on the NCLEX, sometimes they may all be correct. So once again, the client in DKA will be dehydrated. So starting an IV may be difficult, but we need this for medicine and hydration. You can always pause to read the rationales more in depth. The client in DKA will need an insulin infusion in order to bring down the glucose level. So this is a priority. And once again, they will need an EKG because due to the rapid fluid loss and the IV insulin, which pulls glucose and potassium across the cell membrane, this will further alter electrolyte levels, and potassium imbalances can lead to arrhythmias. All right, last question. The nurse is caring for a client who has a chest tube because of a pneumothorax. The nurse can tell the certified nursing assistant to check which of the following. They love to ask about chest tubes and like if the water is bubbling and which chamber, this or that. So definitely refresh chest tubes for your NCLEX. You tell the nursing assistant, remember that chest tubes are a bit more complicated. So assessment of that would fall on the RN. Of course, if in real life the nursing assistant thinks that anything is wrong, they would always tell the RN. But what is something that the nursing assistant can do? And it's check the client's respiratory rate. When caring for a client who has a chest tube, the nurse cannot delegate its care to unlicensed assistive personnel due to the assessment required for management. The only measure the certified nursing assistant can perform in this case is to check the client's respiratory rate, as this is part of obtaining vital signs. So it is important to also be familiar with delegation and what you can and cannot delegate. I struggled with this myself in nursing school, and the other ones are incorrect because once again, it requires assessment of the chest tube system, which you can't delegate to the UAP. Thank you so much for watching. If you would like videos on like a GU or GI, drop a comment below. Let me know if you want like foundations, what subject matter you want me to do NCLEX questions on. Please make sure that you subscribe. It helps other students find my channel.